Reproductive Empowerment Services is a trauma-informed sexual and reproductive healthcare coaching and training service. As I call it, Repro Empower was founded by me, Lindsay Nelson, after decades of experience working with survivors and finding the most effective and efficient healing of my own trauma in my reproductive health care. A couple years ago, I froze my eggs after having a transformational experience with a trauma-informed healthcare provider. Found that process to be very empowering and knew that I was not alone at my age and my experience of sexual and medical trauma, and knew that I had to use that to help our community. Repro Empowerment focuses on coaching individuals and training medical professionals and ensuring that our community is empowered in their reproductive and sexual health care, that they feel in charge of it, and that it goes into their life beyond that. Repro Empower focuses on education, coaching, and training. We create a lot of educational ebooks, articles in journals, and more. We focus on individual coaching on the egg retrieval and freezing process, as well as self-advocacy in the sexual and reproductive healthcare system. We also train healthcare and sports and wellness professionals around what is trauma in their clients and patients and how to empower them to improve their patient relations and their business. We have three main groups of clients, although sometimes they overlap or get referred from the other. First is our fertility clients, those who are interested in having an empowering experience in the egg retrieval and freezing process. They might want help deciding about it, assistance going through it, or reflection after the process. Next is our coaching clients on self-advocacy in healthcare. We help them speak up for themselves to get what they need and make their own decisions in any of their interactions with medical professionals. Last but not least, we have a varied range of medical and health and sports professionals that come to us that want help in their patient relations around trauma. This could be anything from a clinic director, an HR leader, could be a coach, a sole practitioner, chiropractor, OBGYN, and many more. So they may be indecisive or anxious about the egg retrieval or freezing process or fertility in general. They may have cancer or some other medical condition that will complicate or make urgent the egg retrieval and freezing process and want coaching and assistance around that. They may have medical or sexual trauma that makes getting medical care possibly re-traumatizing, so they may avoid it and want assistance around that. Or they could be medical professionals, anything from an OBGYN to a physical therapist who might have client retention problems, client satisfaction complaints, or just generally want some more training around trauma-informed care. In addition to what I mentioned earlier, the one-on-one or group coaching, we also do community workshops, medical professional trainings, and we offer a host of unique trauma-informed reproductive healthcare ebooks, worksheets, and much more. We have the first ebook out on what to expect with the egg freezing process and how to be empowered through it, both for the patient and their loved ones. and a lot more resources. Repro Empowerment's goal is to support our community in their sexual and reproductive health and rights through trauma-informed training of patients and medical professionals alike. We serve patients and doctors around the globe with remote trainings and coaching, as well as in-person trainings in the US and in Europe.